everyone. I'm Sabrina, a licensed massage therapist and certified cosmetic surgery specialist. And this is the Post-Op Podcast. Yes, you heard it here the very first time. On this filler episode, we have officially begun the rebranding phase from Talk Plastic Surgery to the Post-Op Podcast, where throughout this, we're going to finish out season 3 with periodically saying Talk Plastic Surgery and periodically saying the Post-Op Podcast until we finish season 3 completely in June. And then we're going to transition fully into the Post-Op Podcast. But since I have already filmed so many episodes, we pretty much have every episode all the way till June completely filled. I am going to film one on Monday in Denver. And then I'm going to film another one in April 2nd, and then we have another one in mid-April. So there's only 3 spots left. In those 3 spots, we will continue on with the Post-Op Podcast, guys. So as always, once again, welcome to the Post-Op Podcast, where we talk about the good, the bad, and the ugly. And on this highlight hour, I'd like to add, we're going to talk about Stacy, Jennifer, and Claudia and their experiences in this last segment. So let's begin. So on Stacy's episode,
I figured if I have another baby, my husband can't complain if I go and get my final tummy tuck. Right? I had your baby, sir. Now I deserve to have my body back to the way it was. I mean, my husband definitely liked the results. That's how we got this baby.
Yeah. In Stacy's episode, she decided to have a tummy tuck, and Stacy actually had quite a few surgeries before she had a baby. And so she's my first patient that came on the show that had a baby after having so many procedures done. So how far apart did you have your procedures before you decided to have another baby?
So I wasn't going to have any more kids. I was done, right?
Yeah.
And they kind of ask you that when you have a tummy tuck. They want to make sure you're done before you do it. And we were done. My oldest is 20. But when she left home, you really do mourn the loss of your child. Like, they become your best friend and you mourn them. And it made me realize, like, my kids are all going to be out of the house before I blink. And so I said, well, I'm not ready for that.
Yeah.
And we said, well, we have all girls. Let's go ahead and try for a boy. And we were blessed with the 4th girl, which I'm happy with,
yes.
You know.
Oh, and isn't she adorable? And she's so good. Look at her.
Thank you. I'm like, don't jinx it.
I know, don't jinx it. But so how far apart was the last surgery and conception?
The last surgery, the chin surgery?
I would say more the BBL.
I think about 2.5 years apart, maybe 2 years.
Oh my God, that's so crazy. I can't believe it's been that long now. Wow. Wow. Okay. So, what was going through your head when you guys decided, yes, I want to have another baby, and thinking like, oh, I just went through all this trauma with surgery. Did it kind of make you hesitate, like, maybe I shouldn't, or?
No, actually the opposite, because I figured if I have another baby, my husband can't complain if I go and get my final tummy tuck.
Yes, like, yes.
Right? I had
Absolutely.
Your baby, sir. Now I deserve to have my body back to the way it was.
Exactly. And it's kind of like a clean canvas, right?
Yes.
Yeah, especially after kind of the way that the results turned out with the fleur-de-lis, and then the way the results turned out, the tummy tuck, aren't exactly what you wanted.
Yes.
And so now it's kind of like your body resets in a way. Okay, so Stacy's decision in getting pregnant after having her, having had multiple surgeries done, including a tummy tuck, a fleur-de-lis tummy tuck, which a fleur-de-lis tummy tuck is when they cut you in the bottom and they cut you down the middle. So they're going to cut you down the middle like this. And then they're going to cut you on the bottom, and then they're going to tighten up everything in and also internally. So they did also internally corset her as well. And she even said that when she had her baby, it even felt like her abdominal muscles were able to bounce back faster because she did the internal corset. But she also said with her last 3 kids that she had before baby number 4 that her separation wasn't as bad as it could have been. She's more drastic weight loss patient than having diastasis recti. So let's brush up on that a little bit. So now most doctors will say if you are done having a baby, that's the best time to want to have plastic surgery done. So if you're going to make sure that you're done having kids, then go ahead and go get plastic surgery. But at the end of the day, this is all a personal decision. If you watched Sydney's episode from season 1, well, stay tuned for what we have in store with you. A little update from her. And as you can kind of innuendoly see that, yep, she got pregnant, she might have already had the baby or is having a baby, and soon to be having a baby. And she even told me, she said, I'm so glad that I had my BBL done before I got pregnant because she feels like her body is going to bounce back quicker. Now, I've heard a few of those things, but at the end of the day, guys, this is a very personal decision. And, sometimes I've even seen some stories where they'll go through major surgery and then all of a sudden they'll get pregnant out of nowhere, a big oopsie. I can't imagine that, like recovering from having a baby, but also still recovering from having surgery. So definitely very interesting story. And, I'm so happy to have Stacy come on the show, especially with her baby. Her baby was so good. She was such a good baby on the show. And I know she looked like a little China doll. You couldn't even tell if she was a real baby or not. But she was so good. Such a good baby. And Stacy even said that she can't wait to have her next procedure done now that she had her baby. And soon she wants to go to Dr. Skurlock, who is in Florida. He's actually an amazing surgeon. I have seen quite a few work from Dr. Skurlock, and he actually is so good. I highly recommend him. But of course, always be careful and be wary of the post-op care that you get in Miami. From anywhere, but definitely Miami. I've seen some crazy post-op care come from there. So be mindful. So now let's talk about Jennifer.
I got a lot of confidence and self-esteem and like good emotions.
And how would you rate your whole experience with this?
Oh my gosh. If I could give it like a 1 million out of 10, I would. It was such a great experience.
So Jennifer, she had a breast reduction. And actually, I think Jennifer is our very first person to come on the show that had a breast reduction with no implants. And she chose not to have implants. And honestly, it was a good choice because she had so much breast tissue. She had so much breast tissue that it actually helped her look like she had implants in, and they do look very perky, very natural. The incision line's very beautiful. So on that note, then what size were you before?
I was between an F and a G before, I guess. Yeah, F and a G, I guess. Yeah. And I was always just my back.
And that's boobs, guys.
Yeah, that's boobs. Yeah,
an F and a G.
Yeah, and my back was really hurting. It was hard to sit up straight.
And that's after you lost the weight.
Yeah, but they were it was a lot of skin.
Yeah,
very loose skin. So,
wow.
Yeah,
but that's still crazy. An F or a G.
Yeah, it didn't fit my body frame.
And painful.
Yeah. Very painful.
Yeah, because you're small.
Yeah.
You're small. So carrying all that?
Yeah, it was crazy. Yeah.
And so then when he went in, how much tissue did he end up taking?
He took out over 300 cc's
her boob. Yeah.
And mind you, like seeing your before and afters, I'll never forget.
Yeah.
I thought you had implants.
Oh,
and then also I was like, wow, like when you told me you didn't, I was like, wow, you must have had a lot of tissue still.
A lot of tissue.
Yes.
Yeah.
Because they do look very natural, but they're so perky still.
Right. Which is awesome. Yeah, they're very natural. Like they have a drip, but it doesn't look like. Yeah, they don't
like exaggerated. No, they look perky and refreshed.
Yeah.
Yes, I love that. Yeah. And so then 300 cc's from each boob. That's crazy.
Yeah.
And so that first week, how did it feel kind of that first week of recovery?
You know, I wasn't in a ton of pain. I did take some pain medication, but quickly got off of it because I didn't like the way I felt. So I was on it for 2 days, and then I was taking Advil afterwards. It was a really quick recovery period, really looking back.
Yeah.
So, yeah.
Absolutely. And what kind of inspired you to find massages?
So a good friend of mine knew I was doing the surgery, and she told me that her friend Erica had, she was just 2 weeks post-surgery. And so she was like, I had so much success with the lymphatic massage. You have to go to her. And I was like, okay, because I am a freaker outer. I get a lot of anxiety. And so I was like, this is perfect. Just so it was someone in the journey with me for the recovery, which was so amazing.
Yes. And to kind of tell you you're okay.
Yeah. I'm like,
and that this is normal.
Yeah. I was like, they're green.
I know. Yeah, they were so purple.
Yeah, they were very purple.
So all the colors.
Yeah, all the colors. And you were so sweet to be like, this is normal, or this is crazy. And I still traveled, and I was still not very much change in my everyday from the surgery. So it was nice to know, like, this is okay, or, I'm sure you would have told me to go to the doctor if something wasn't. So it was really nice to have that support person as well.
Absolutely. And that's why the massages are so important, and also to kind of get that inflammation down, because as you saw, like the before and afters, like they were huge,
right?
And then as we got that inflammation down, now they can settle down to be nice, perky, normal breasts.
Right.
Wow. So Jennifer was a size G. Her bra size was a size G. That's huge. That's like out to here. That's like painful. Like I can only imagine her back. And she even said it, like her back hurt so much from how much weight her shoulders were carrying, from how big her bust was. And it was so big that Dr. Richards took out 300 cc's from each breast. That's a whole implant, guys. Literally, I know so many people who get 300 cc's put in each breast. That's a lot. So, but the good thing is that Jennifer didn't just have skin. She had a lot of tissue. So when Dr. Richards did do the lift, it gave her such a nice look, very natural, very perky. I even asked her a few times if she had implants put in because they look so perky and nice. But like, thankfully now, after seeing her like and recovered and everything, she's so happy, and seeing how good her recovery story was, that's why anyone should have surgery. She's been dealing with that for years, and finally she took the step to go ahead and go through with the surgery, and she's more happier than ever. And the fact that now she can look in the mirror and be like, this is who I'm supposed to be, and throw away those boobs and never want to see them again. That makes me so happy. Because on a little segue, I went into Gronk, Elon Musk's AI, and I told Gronk, I was like, okay, give me 420 Motiva implants. I want to see how I look. And when it did, the AI straight up gave me boobs. I was like, oh my God, that's not me. That's not me. I don't want that. And it's so funny because I do see a lot of people that they're like, why did I do this? I can't believe I did this. If I knew it was going to be like this, I wouldn't have done it. Well, I kind of felt that way without doing any surgery. And when I saw myself, I was like, imagine if I went through with this. Like, that's not me. I don't want that. So when you, like, for her, how she did it, and she's like, this is exactly what I wanted. This is exactly how I'm supposed to look like. That's why you have plastic surgery, honestly. Because now, and honestly, even like after we talked to Dr. Sohn on another interview, that's what AI could definitely help out with the most. Because imagine you go through with a surgery and it's not what you wanted or expected, you know? Like Claudia. So, on that note, let's talk about Claudia's procedure.
It's scary to think like, okay, what if I do go get the rest of my body done and they botch? It really traumatized me. Like, I don't want to ever do anything to my body ever again. I kind of went through a depression state where I'm like, why did I do this? It was depressing.
So with Claudia's procedure, I was gonna say Claudia's episode would be a bad episode, but I chose to go more with Stacy's episode being a bad episode because of the way her experience went with her tummy tuck and with her BBL not going as planned. The reason why I decided to name Claudia's episode as an ugly episode is because what she went through sounds very similar. It sounds just like what Amber went through in season 1. And I'll drop the link in the bio to Amber's episode. The thing is that Claudia was manhandled. Literally manhandled. And had her procedure done so fast that it left her traumatized.
So literally the whole time it was like a nightmare. It's like when you have those dreams when you're like something's happening and you can't wake up. It literally felt like that. Like an out of body experience.
Like sleep paralysis.
Yes, exactly like that. And so I was just like, I was trying to like calm myself down because the medicine still had not kicked in. So I'm still very anxious.
Did they even put like lidocaine or like inject you?
They did.
With numbing or anything?
They did, but I still felt a lot. So I don't know if maybe I don't have a high pain tolerance. I don't know. But felt...
How soon after they injected you with the lidocaine did they start doing the procedure?
Oh, right away. And that's why I think...
No, girl. It didn't set in. Okay. Literally, when I went to Mexico to get my wisdom tooth taken out, my dentist, I had to have it surgically taken out, and he put the lidocaine in my jaw. And literally, he waited 25 minutes for it to take effect, for him to surgically remove my tooth.
Yeah.
And I felt nothing.
Yes. Okay.
So if they literally injected you and started...
Yeah.
It didn't even take effect yet.
Yes. Like, so the way I had my hands positioned, there was like a little thing where I can hold on like to the seat. Every time he went in to start like... sucking out, like the liposuction.
Yeah.
Every time he went in, I just kept like grabbing. My knuckles were so wide because I was just holding on. It was one of the most painfulest things I've ever done. And every time he would move my face, he would move it like this. Like that. Like no gentle, like let me move you this way. Okay, I'm gonna move you this way. No, it was very like, I was just like, oh my gosh, why did I get myself into this? So then
no wonder you're traumatized.
Yeah.
That's so traumatic.
Yeah. Yeah. I'm like, I never want to literally.
So he started operating on her without the anesthesia even taking effect. And they kept throwing out there that it was only going to take 20 minutes. It was only going to take 20 minutes. And sure enough, it really only took 20 minutes. So how can you go through with something like that and only it taking 20 minutes? And it's so funny because when you hear other people's experiences and how long the surgeon took with them and how the surgeon took time with them and actually cares about them, it's like, how can you treat a human being like that? Like, how can you go in there and aggressively do lipo where she can feel everything? She could feel everything. She can hear it. And then just move her head like this, taking kind of advantage, right? Now she's like holding on for her dear life. And go back and rewatch that episode. I didn't realize how crazy it was until I had to watch it a gazillion times this last week. But after watching it a gazillion times, I am still flabbergasted every time I hear her experience. And I know the history of this surgeon. And if you guys want to know, watch the Sabrina Diaries live. But anyways, with like what happened to her, it's genuinely sad. It's so sad and it's traumatic. It's so traumatic that literally Claudia said she never wants to do surgery ever again. And if you if you're a surgeon and you are gonna traumatize someone that bad to not care, to not make sure that the anesthesia took effect and everything else that took place after. Like I said, it's a very good story. I'm not gonna give away too much. But if there's anything that you want to know, is that you should definitely go back and watch Claudia's episode. And no matter what, if a surgeon is going to paint you rainbows and roses, then do your research and talk to people who have gone there. Because sometimes things are not what they seem. It's even on Instagram, even on TikTok, even on YouTube. Sometimes people are not who they seem. And on that note, thank you so much, Claudia, Jennifer, and Stacy for coming on the show and sharing your guys' stories. Welcome to the new era of podcasts called the Post-Op Podcast, where we talk all about the good, the bad, and the ugly. And always sharing real people's stories with real people's experiences so that you guys can do your research while you're watching the show. And if you have any questions, please send me an email on my website, and I will get back to you when I can. And as always, guys, like, share, subscribe, hit the push notifications for all things post-op. Bye!